Dun, dun, dun. Welcome to the Dr. G Show.
Welcome, welcome.
I'm Dr. Patrick Garrett. I have a functional lifestyle medicine clinic here in Wichita, Kansas, and we serve patients all around the world. I'm in DC and have postdoctoral diplomates in clinical nutrition, functional medicine, and basically all we do is lifestyle functional medicine. Just figuring out how things work, teaching people to stop causing their problems. So most of it's pretty simple. And just like today, we're going to talk about our second part of kind of IBS and Crohn's and ulcerative colitis, which is one of the things that we have the absolute most success with. And I love when patients come in with those because it's usually like night and day difference. There's Diane. Is it Diana? It's Diana. Diana Nelson. And Alfredo. I saw him at Borchet's Martini Bar the other day. He threw a button at me from across the room. So, and there's Jenny. As you guys join, feel free to post questions. So last week we talked about...
Do I get to get introduced?
Not yet. Oh. They haven't seen you yet.
They have seen me.
All right. This is Sherry Clark.
Yes.
Hey, there's Wendy Funk. So Sherry Clark, she's an RN. She does health coaching. She does the same kind of functional lifestyle medicine type of approach, and highly successful. And she's joined us today to talk about all this, which she's had firsthand knowledge with, and she has lots and lots and lots of studies where lots and lots of research about kind of gut and bowel and bacteria and all this kind of stuff. So, Wendy said something.
She's driving.
Oh, you should focus on this while you're driving. If you tape this to your windshield, then you can watch this while you drive.
No.
I think if something happens, Sherry said that.
No.
So this is episode, I think, 165, and second part of our three-part series on IBD, Crohn's ulcerative colitis. So if you guys know people with that, let us know. Let us know their names, their address. No, just kidding. But let us know if you know somebody that has these, because this is really common. And last time we talked about how it's an epidemic, especially since 1950s, but really in the last like 10, 20 years, it's been skyrocketing. And the prediction is it just keeps doing that. So for the next 20 years, the expectation is that we are just going to get exponentially more. And like me and Sherry and I were debating whether it was male or female, but the research shows that it's pretty much just kind of like both, male and female. But different studies show males a little higher, different studies show females a little higher, but overall, everybody's super screwed. So, unless they make some changes. So last time we talked about some of this kind of genetic stuff. Next week we'll talk about immunology stuff, so how the immune system is interacting with this and how we fix that, or help you fix that actually. And today we want to touch a little bit more on kind of the cost strategy of this, because it's super expensive to have this. It's super expensive to manage it. It's super expensive to treat it. But from the natural functional...
It's super inconvenient.
Yeah. And pooping in a bag's awesome. That's great. Right? Somebody gives you a bear hug, bag pops.
Oh, that wouldn't be good.
So, from our standpoint, we are the absolute dirt cheapest possible solution people ever have. And it's sustainable, which is nice.
You don't have to stay on a med forever, typically. You know, you after you make the lifestyle changes and you learn how, and you don't even really need us either, forever and ever. Yeah, but we teach
that sounds
people.
Like parenting.
We teach.
It's like parenting.
Yes, it's kind of like parenting.
And then they go away and they're like, "We don't need you. We know how to take care of ourselves."
Yeah. We're gonna talk also about
say it.
Lifestyle, how to.
I thought you were going to say
we're going to tell
quorum.
all our secrets. Oh, we're going to tell. We're talking about quorum sensing too, which is something bacteria do.
Yeah. So.
We're smarter than you think.
Super smart. Well, you know, it's funny because they have the whole Human Genome Project. We got that completed. We didn't think that was going to be possible. And then now we're like cranking out that stuff like nothing. But after the Human Genome Project, they came out with the Human Biome Project. And that one is just blowing up because there is so much knowledge that's missing from knowing all the stuff about our human biome, all the bacteria that live in us and on us, right? So we'll talk a little bit about that. So a little bit today about cost, and then the other part we want to cover is the environmental factors. And these are nice because most environmental factors you can control, right?
Very empowering.
So,
oftentimes if you have conventional treatment, it's disempowering because they say, well, there's nothing you can do. It's nothing that you're doing. We don't know why it happens. You're just unlucky, and take your medicine.
yeah.
And sometimes you need to take your medicine for a while, but if we can change our environmental factors so that we don't have to do that and just don't have the problem anymore, that's definitely optimal.
Yeah. And you know, like when we looked at genes, there was 100 genes for inflammatory bowel. There's 50 of them dedicated just to Crohn's and ulcerative colitis. There's 7 that are priority. There's 2 that are targeted for drugs. But the reality is, only 1% of disease is genetic. So all that stuff we talked about last week was 1%ers. Today, we're going to talk about the 99%ers.
Yep.
Everybody else that has Crohn's that can be easily reversed, right? And ulcerative colitis, and irritable bowel. And you can throw like reflux in there, gastroparesis, all that stuff.
There's a study that says 36% of people who have both parents who have inflammatory bowel disease will also have inflammatory bowel disease. So there's not probably all that many that have 2 parents that have it. And even then, it's only 36% chance that you will have it. So what that says to me is that there's a tremendous amount of environment.
Right.
Well, which is what he just said.
And you know, we see things all the time in our practice where it's just like, well, you'll see things run in families, but that's typically because if you eat like they eat, you do the things that they do, you're going to get all the same conditions. So, cost-wise, let's talk about that first, because there's some really good information on that. We got the 2019 cost analysis for Crohn's and colitis, and this is insane. So the first year direct cost, so this is what the patient actually pays out. The first year is between $8,295 and $49,073, with an average of $25,000. So, you know, it's a crazy thing because that means that most of those patients that find out that they have Crohn's, irritable bowel, ulcerative colitis, their average cost the first year is $25,000 across the board. If they get treatment, like if they have like kind of really symptomatic, like sometimes it's very severe, just the cost of tumor necrosis factor therapy, which is the immunotherapy, is $29,508. That's insane. So like patients that come here and they're just like, well, how much is this going to cost? Nothing compared to what you're going to pay otherwise, or what you already paid. Like to reverse or prevent, we're not going to say cure, but to reverse it, holy crap, it's insanely cost effective. Insanely cost effective.
And well, the biggest factor is probably, the impact it has on your life, your social life and your professional life. And these figures don't even count missed work days or perhaps even losing a job because you can't be at work. You know, these people are having 20 to 40 bowel movements a day. There's some jobs you just can't.
Right.
Most jobs you just can't do if you're constantly in the bathroom.
Like even people without it, you have those times where you eat something or drink something, you're like, whoops, you know, you got some bowel urgency. This morning I had to do a corporate presentation, and I always get my coffee with like almond milk, And so...
Is this going to be a TMI story?
It's always too much information. I'm willing to be vulnerable and transparent.
It's a good...
Even down to bowel function with these people, right? They're my friends.
Okay.
My friends!
You ate dairy is what you're telling us?
I don't know, but I drank that...
they lied to you?
A little bit, and holy crap, my tummy started grumbling and stuff, and I was just like, I'm going to have to, like, take care of things before I go, because, like, holy crap, right? But I'm like, you know, think about that. Like, that's how people are all day long. Like, when I have that kind of stuff, like, it's so rare.
It's much worse than that, you know.
But, like, how can you have a meeting?
You can't have a meeting. You can't teach a
cough.
class. You can't...
Can't laugh too much. If you laugh too hard.
Yeah.
Yeah, so this one, you know, in this research article from the, it was from the Crohn's and Colitis Foundation, it said the high financial burden and low quality of life associated with these conditions are extreme. So patients can expect years of persistent diarrhea. Now I know we all like diarrhea, but not persistent diarrhea. Abdominal pain, rectal bleeding, that should
Well, and just constant urgency.
this would be good for dating profile. And then high anxiety, everybody loves that. Depression, I'd be depressed with that.
Chronic fatigue.
Which, got a question. Does research show that psychological therapy helps with the anxiety directly associated with Crohn's? You know this.
I know this.
All right, so
they don't know.
No, you tell them.
No, it actually doesn't.
Yeah.
Because talking about it to your therapist isn't going to make your anxiety go away if you still have the ongoing symptoms and you have the prospect of always having those symptoms. I think that's why.
Yeah. I think there's a lot of tips and things that they can help with quality of life, but the fact is if you think you're going to poop yourself all the time, that sucks. That's just going to be part of your anxiety is a constant, real physical issue there, right?
Right.
So it's kind of like having a tiger that keeps chewing on your leg and being like, how does that make you feel? Like, again, not just in therapy, because that's super
Therapy's
effective
good,
for everything
but
except for pooping your pants. But you know, people that have irritable bowel, it's probably easier. But when it's full on, the studies show that it's not very effective.
well, I don't know. Irritable bowel, you have constant pain, you have alternating, you know, diarrhea and constipation, and if the your counselor's just telling you to deep breathe, it might help some. You know, think differently about it, be positive. It's very difficult, you know, because it's, I think, the lack of hope, the hopelessness.
Yeah.
And that's what we are going to help you with.
Loss of menstrual cycle, so that's infertility.
Yep.
I have never even started my menstrual cycle, so...
It's probably a good thing.
And then, which is funny, you won't have your menstrual cycle, but you'll have constant rectal bleeding. So you're still bleeding, still gotta wear a pad. And then night sweats, I think that's a cologne for men. And then urgent need to move your bowels, chronic fatigue, because yeah, especially when people are bleeding too, they are just exhausted. So the psychological burden can be overwhelming for patients, worrying about the next flare, unexpected severe pain, and of course the embarrassment directly affects them, their mood, anxiety, and depression. So that's, you know, the cost is a big part of that, but really quality of life is all that really matters in the end when it comes to IBD and Crohn's and colitis, you know?
And this takes a huge toll on relationships too. I mean, you know, your partner's going, well, wait a minute, this is not what I signed up for. You're no fun. You're, you know, alternately laying on the sofa and running to the bathroom. We can't go do fun things anymore. You're not fun. And it's hard to be a parent with these symptoms.
Yelling at your kid now, just a minute, give me 20 minutes, I'll be right back.
So it affects every area of life.
Yeah. And financially,
now those figures that you quoted
yeah,
are, I mean, some insurance will pay some of that if you have insurance. But,
right.
you know, a lot of people have high deductible insurances, and so you're going to be meeting that deductible, you know, every month or something. And
it's crazy. So Yeah, and the other thing too is like the medical standpoint, the non-lifestyle medicine approach, the relapse rate is 46%. So you might pay your $25,000 to $50,000 the first year, but then your expectations, even if they shut down your immune system, most people are going to relapse, and then you have to pay all that money again. And half of it's on pharmaceuticals, a quarter of it's on hospital stays because they end up bleeding out or having such severe things that they end up in the ER, which is the most expensive. And then outpatient is a big chunk, and then it's all the other little things like doctor's visits and
emergency room.
Yeah, home issues. Are you reading the same chart?
I might be.
She's cheating. So.
Well, I mean, if you have a lot of bleeding issues, you're going to have your blood count, your iron's going to be always low,
Crazy
causing
low, yeah.
fatigue. But you're going to need blood transfusions, and it's just a whole another set of risks. And
Yeah.
not fun.
Hey Gina, thank you for watching. So the standard, industry standard is 46% relapse. So Sherry, when she came in today, she was asking me what our relapse rate is. And I gotta say...
Well, and that would be, only to be fair, we have to consider compliance. I mean, some people don't do what is suggested, and so they cannot expect that their remission rate is going to be good. Chances, not good.
And I could only think of I think 3 or 4 cases where out of all these years where someone didn't resolve it completely. And one of them, they didn't do what they're supposed to do. They were saying they were doing it, and then they finally admitted they weren't doing anything. And so it was like, oh, okay, of course it's not working. The second one was a person that completely got rid of everything, and then started eating those foods that he's not supposed to, and then he started having little flares, and then it all came back with a vengeance. And then one of them ate at a fast food restaurant where they used MSG, and that put her pretty much asymptomatic, but right back in the hospital. And so that's how powerful how horrible some of that food is, right?
MSG and who knows what else.
Mm-hmm. But now she's back on track, and we'll get her to the point where she's med-free and doesn't need medical management anymore. And she's compliant. The others weren't compliant.
Well,
but it's interesting too to see that one case where, again, seeing somebody go from just their life is destroyed to where they're completely symptom-free, and then they're gaining weight, they're getting their energy back, all this kind of stuff, and then you see them start back on that path and starting to have those problems, and you're just you want to scream at them, you can't do this, but you can't change people unless they want to change.
Oh, but it's too hard. They had cake at the party.
I love that group.
I need my cheese, and
Yeah.
we all need our cheese. We think we do, but we don't.
99% of patients that come in here, they say, I love cheese. You don't understand, I love cheese. I'm like, yeah, it's morphine. We all get it. We all want our drugs, right? So compared to that, so if you compare a relapse of the standard medical approach, it's 46%. Of those who stick to it over 17 years, we've only, I think, had 3 people that didn't stick to it, and then 1 just messed up. But I think we have damn near compliant patients, usually because
they're highly motivated.
Yeah.
Because when they know that they can feel normal and well and not have their life and their career and their family all disrupted, then it's a powerful motivator.
Yeah.
As the thing is just to get people to believe that's possible enough so that they'll try it.
Yeah. And I think people are pre-sold by the time they come to me. They're usually willing to make all the changes because they've done everything before they come see me, which is nice. And you probably have the same with your clients, yeah? They're just all right, let's do this thing. So...
The more severe the problem, the more compliant.
Yeah.
patient, typically, once they start seeing benefit.
I had coffee with this woman the other day, and she runs a clinic, and she said that there was 2 people that she knew that were like, Dr. Garrett saved so-and-so's life.
Yeah.
And I think they were both Crohn's patients, you know? And you watch with Crohn's patients, and you see them just wasting away to nothing. And it's just so distressing, but then when they get their life back, and they're perfectly fine, like, it's wonderful. So, cost-wise, it's a no-brainer to just do functional lifestyle medicine. Just stop causing the problem, but find someone that can teach you how to do that, like us.
Even if you do not are not able to use your insurance, you'll end up paying less over time.
Because you're going to pay all that
I mean, because it doesn't take that much time for
Holy
us
crap.
to lead you through the program and for positive changes to start occurring.
Yeah, because we see patients probably every week for 6 to 7 weeks to make all these lifestyle changes. So, there's Stephanie and there's Angela. So if you guys have questions about the stuff that we've covered already, let us know. Next we're going to talk about the environmental stuff, and this is where we get in some really interesting kind of discussions of how to approach these things. Now, we cover all these things already in our treatment protocol, but this is the stuff that literature shows, and we got really good research results from meta-analysis that we're going to go through.
I just had a thought.
What?
It happens sometimes. I'm looking at your stats here. There are over 2 million office visits for IBD every year. There are over 4 million prescriptions written for IBD every year. And there are 500,000 hospitalizations for IBD every year. Just think, if everybody didn't need those services anymore, think how our insurance rates would go down, for one thing. You know, it's a burden on the medical community to have this constant drain, and honestly, they don't get better, you know. In some cases, even after the surgery, lesions will appear in a new area, and they just have to start treatment again. So, yeah, it's a dismal prospect. The answer is to change what you're doing.
Yeah, and so genetics, only 1% of the problem. We can address that, but the environmental factors are the things you can control. It is the things that make substantive, substantial, sustaining changes for you.
And I think we said this last time too, but you know, maybe some people listening are saying, "Oh, I have a friend that complains that they have tummy trouble, or they have whatever, or they have something going on. They don't talk about it in detail, but they're not to that stage. I mean, they're not like having things chopped out and bags and you know, but it can be progressive.
Right.
Most sufferers don't start their symptoms until they're adults. 20 to 29 is the most common age group for new symptoms, but can start anywhere, and there are some children that have it too. But if you start having symptoms, your body's reacting, it's creating an immune response, and if you keep doing what you are doing, it will get worse.
Yeah.
So just because things are not super critical now doesn't mean it wouldn't be a good idea to reverse it before it gets to the stage where it's horrendous.
Yeah, to the point where you're carrying a roll of toilet paper in your car just in case all the time. Yeah, that's a good point, is nip this stuff in the bud before, because it really is, like Sherry said, a continuum that you just see people get progressively worse, and you want to stop that when you have just stomach pains or just some gastroparesis or just reflux, you know.
Right. And there are some junctures in life, such as for women after pregnancy, where flares are more commonly occurring.
Yeah.
And you don't want that. You don't want to feel worse when you have a new baby.
Are you sure?
It's bad enough.
It gives you one more thing to complain about, right?
It's true. One more reason to be tired.
Did you go with my joke? That's so bad. Okay, so our environmental things or lifestyle things that research shows that substantially causes more complexity, or I don't know, how would you say that? It causes more flares, more likely to contribute to this problem.
I think these are things that contribute to the chance of having
it. Yeah.
Yeah.
So
and then also, like you said, they make it worse once you do have it.
One thing is smoking.
Smoking. We all know smoking is bad.
Is that right?
It's my understanding.
What if you switch to vaping? Is that better?
I don't think that's better. No.
So smoking, because there's 5,000 toxic chemicals that you're breathing in. Now this is funny because you think smoking's bad, right? But studies show that, especially since 2006, the American diet is the leading cause of preventable death over smoking. School lunches are worse than your kids smoking cigarettes.
And just think how healthy you would be if you quit smoking and quit eating school lunches.
Mm-hmm.
Yep.
I stopped about 12th grade.
Smoking?
I said, no more school lunches for me. I'm done.
You can eat school lunches out of school.
Oh yeah, just the same crap, right?
Same thing.
So smoking, that's an easy one.
Well, it's not easy, but it's
I
obvious.
mean, obvious, yeah. And
we have sympathy because it changes your neurotransmitters, and we do things. We like to do things that give us dopamine.
Yeah.
But it's worth seriously thinking about it, getting stopping that.
And then NSAIDs. So NSAIDs are aspirin, ibuprofen, those COX-1 enzyme blockers. Now Tylenol's not. Tylenol, they don't know why it gets rid of pain. But most of those are COX-1 inhibitors. And they actually mess up the mucus production. So when you block that pathway, you block the pathway to pain. You also block the pathway to mucus and the pathway to clotting your blood, which is thromboxane. So your whole digestive canal is covered with slime, so all that roughage doesn't just tear away at your lining like sandpaper. And if you take NSAIDs to stop that production of mucus, you then irritate the hell out of your small intestines, let alone large intestines with that.
So it pokes holes in your digestive tract, and the disease also pokes holes in your digestive tract. So if you put the two together, it makes more holes.
Right, you're just like taking a skinned up knee and rubbing it with sandpaper. The other thing too is when you hit blood, so like ulcerative colitis, and Crohn's, they'll bleed. Even the irritable bowel will see blood.
So your blood is thinner, you bleed more easily, and on NSAIDs, isn't it true that after 2 weeks, everyone has microscopic bleeding just from taking NSAIDs? And I know, my group of people that were in school with me about 10 years ago, I think I was the only person not constantly popping NSAIDs and antidepressants, but NSAIDs, just constant. I guess they had a lot of pain, I don't know, headaches and such things, which were mostly caused by things they were doing, but whatever. So, yeah.
So that's where, I mean,
very common.
It's gonna increase your bleeding time with everything. So then it's harder to get people to stop having the bleeding, because we always look at, like, so when patients come in, it's like, what's the urgency? What's the blood? What's the mucus in your stool? Undigested food, and then frequency of bowels. So that's our kind of like metrics by which we can tell whether things are getting better or not. But NSAIDs are going to significantly delay that process. And I'm glad you said that, because studies show that 70% of people that take NSAIDs for greater than 2 weeks have a GI bleed. And it's probably worse than that. 70 was probably the good number.
Well, and it may not be noticeable to the person taking the NSAIDs, but
they're going to bleed slowly, yeah. Like they don't notice.
It might be from the stomach, it might be from the small bowel, it might be from the large bowel. You don't know.
What do you think of appendectomy? So people have this appendix, and so your large intestine goes up, over, down, and out. And then when the small intestine connects into that, there's a little tiny appendage called the appendix. And that's right. And so I learned in school, it's a place where it does a little kind of bacterial check, or like it's like a little laboratory. And so stuff will leak in there, and then your immune system will kind of figure out what's going on there, kind of like your lymph system does. But if that becomes inflamed, then people often will have it removed. But you said that it...
I have a theory.
Uh-oh. All right.
Okay, so if you have an appendicitis where it gets inflamed, I believe that the research that I have read indicates that that person probably has dysbiosis. They have a, wrong balance in their bacteria. They have more bad guys than good guys, if you want to look at it that way. So that's why they get the appendicitis. So that indicates that there's already a problem in the intestinal tract. And then what we have seen in research shows that if you have an appendectomy, you have a greater chance for ulcerative colitis later in life, but less chance of Crohn's later in life. Why? I don't know. I don't have a theory on that.
Do you have your appendix?
Yes, I have my appendix.
I still have my appendix.
I'm planning on keeping mine.
So that means we're both going to get what?
No, we're healthy.
Oh, that's right, we're healthy.
We haven't had ours out.
No, that's right. So,
no. But I mean, it's not something like you should fear. It just is an indicator maybe of the type of bacteria that would overgrowth that would be more symptomatic of ulcerative colitis.
So smoking's an easy solution. Just to stop that. The NSAIDs, again, if you're taking chronic anti-inflammatories, you need to meet with someone like us or another lifestyle medicine doctor to teach you how to not need chronic anti-inflammatories.
Right. If you have chronic pain, you need to figure out how to not have chronic pain.
Or go to the chiropractor and get adjusted.
Well,
I can't tell you how many patients I have with chronic pain. Go to the chiropractor, get adjusted. I'm a chiropractor and I still wait forever. And I'm just like,
Not me, man.
I need to get adjusted so badly. And then I finally get adjusted. I'm like, yeah, why don't I do this more often?
Chiropractors are gentle. Chiropractors are kind. The new chiropractors are good. Go to a chiropractor.
What about the old school rough ones?
I've heard bad things about them. I've never been to one.
So I go to one, and
you like that,
he pushes through everything like it's awesome. But I wait too long, right? But neck-wise, if they jerk my neck like that, I'm not going back. But if they just take the neck and...
Can we do ads?
Who? Yeah, tell them. Who do you like?
I really love my chiropractors. There are two women, Megan Sullivan.
Are they conjoined?
No.
Oh.
Kylie. Oh dear.
Dr. Kylie?
Dr. Kylie.
There you go. That's it.
At Healing Hands Chiropractic in Delano, and they're awesome. And they're super, super kind.
Aren't
gentle.
they in that place where it used to be a chocolate factory or something?
Next
chocolate
door.
So
Next door, it's a crepe factory. Don't go there. Don't go there.
All right. Okay, so pain. Figure out why you have pain. Stop doing that. And then turmeric. We've had shows about that. We'll talk about that later.
So actually, a lot of these are related. So
we're gonna wait.
Okay, so we talked about dysbiosis a little bit.
We'll talk about that. I want to lump these together.
Okay, lump them together.
So the vaccines, so that's a separate one. So vaccines are one of the ones that show that it can cause increase of risk of IBS and Crohn's, ulcerative colitis, all that. Let alone, if you use WI-38 ingredients or MRC5, those are aborted fetal cells, which is sketchy.
Well, do you suppose that the heavy metals involved there have related to that? To the increased incidence?
Oh, yeah, because, in the journal
Mercury.
Cancer, it says that the journal Cancer actually showed in one of the research articles how vaccines cause cancer. So instead of causing cancer, the flip side of that is autoimmune, right? So T cells look at cancer cells and get rid of those. And then they also don't attack your own cells. So if you mess those things up, then you either end up with cancer or autoimmune condition. So
either way, your immune system isn't working optimally.
Yeah. So vaccines are a whole thing. Get it if you want. If you get some Crohn's, just come see us. But it's a whole thing. We're not going to get into that. We're not getting into that. I want to get into it. We should not get into that.
Not today.
Okay. Parasites. Parasites are worse than a unicyte because there's two of them. It's a pair of sites. Is that glasses? Parasites are glasses. So CDC says that 1 out of every 2 Americans has a parasite. And we used to say that bacteria was bad, but now we know almost all bacteria is good. And then we said viruses are bad, and then we know that some viruses are good. And then we said parasites are bad, and then we found out that some parasites are good, right? So the worst parasite is a dude with no job that borrows your credit card in your car, and then he crashes it, and you find out he's cheating on you. Is that the kind of parasites we're talking about?
I don't think that's what we're talking about.
Oh, parasites like tapeworms, what?
Oh,
those
there's,
kinds?
yeah, they're infinite. I don't know, there's tons of them. Pins, worms, roundworms, but those are the
roundworms are the worst.
Big, but there are other.
There's a lot of it.
Other things.
Yeah.
There are some that actually have a beneficial
someone
side.
said, hi, Sherry.
Hi, Lynette Martin. Oh, cool. Hi, Lynette.
So, and Angela has a question here. So, should we not? Oh, I'm not.
Well, that's a different
Whoa,
show.
Angela, you're trying to get us.
He could get shot.
Murdered in here.
Yeah.
So we've done a show on vaccines, but vaccines really, it's just knowing
They're problematic.
all the risks,
Or at least I believe they are.
all the benefits, and then making a decision and just not looking back.
That's right. If
So.
you've already done it, it's too late to not do it. So we just optimize with lifestyle.
So so parasites, infections, and then so from infections. No, we'll wait on infections. Vitamin D. What do you think about that?
I think that vitamin D is so important, and it is a factor in every condition that we've ever looked at.
Yeah, it is.
And so if you have low vitamin D, I think it's your immune system. It just doesn't work right.
Yeah. So vitamin D, having optimal levels of vitamin D naturally, first of all.
Hopefully, naturally, yes.
Hopefully naturally.
It's kind of hard in January.
Prevents 100 different cancers. And it's not that it's specific to any cancer. It is just like this research for fruits and vegetables and for green tea and for fiber and turmeric, is that it boosts your own ability to correctly identify and target cancer cells through interferons, natural killer cells, cytotoxic cells. So again,
low vitamin D is a risk factor for any autoimmune disease.
That's
so
right.
If you have low vitamin D, you're playing roulette. Your chances of getting something, your immune system switching to attack yourself is super elevated.
So think about this. This side of the disease is cancer. This side is autoimmune. But it's the same hand, okay? Tell me one drug that Americans take to lower vitamin D and put themselves at higher risk.
Cholesterol lowering drugs.
That's right, statins. Statins block cholesterol. Cholesterol is made into vitamin D through cholecalciferol. No, through ketocholecalciferol. So when the sun hits your skin, that big ball in the sky, when it hits your skin, it converts cholesterol into ketocholecalciferol.
Cholecalciferol.
What? Chole. What's that other word we learned today? Chupacabra? It's
cabracho.
Cabracho.
Never mind. Different thing. Okay, but then your kidneys are involved, your intestines involved, your liver's involved. So everything is involved in making vitamin D. So if you have problems with any of those things, you might not be super efficient at making vitamin D. And most importantly, if you are in the sun in the summer, there have been incidences shown where surfers have low vitamin D. Why do you think? Because they wash the oils off their skin constantly, and they don't have the cholesterol on the skin.
Sunscreen.
Well, before sunscreen, even. So anyway, if you want to be efficient,
What are they washing it off with? The salt
water. So if you want to be an efficient vitamin D creator, optimally you will not wash the exposed to the sun areas for 24 hours, and especially not with soap.
That's right.
Yep, just let the water run. And
Still wash.
wash, but just don't
use
scrub
soap.
your skin with soap, or you will wash away the potential to make vitamin D.
Plus, you keep all this cloud of good bacteria on you.
That's
so
true,
then you
too.
don't. Someone would be like, "I have the coronavirus," and you're like, "Whatever. I'm a walking petri dish."
Yeah. Yeah.
So,
This one.
sleep.
Sleep. If you don't get enough sleep, you're susceptible to everything. And it's different for everybody. He doesn't sleep much. I need more
No,
sleep.
I sleep the right amount.
For him,
For
but
me.
not the right amount for somebody
6
else.
hours, I'm a rock star. Right? All I do
Just
is
think how good he would be if he slept 7.
I just take a little meth, and then I don't need to sleep for days, and then I get 6 hours a week. No, so 6 hours.
Whatever your optimal amount
Your
is,
8
that's
hours?
what you need
What is
to
your
do.
what's your optimum?
Uh,
How
if
do
I
you-
sleep well, I only need about 7, I think.
All right.
Yeah.
So then we get to the really good stuff,
Which is all kind of related.
Yeah, exactly. That's why I saved it. See, so it all relates. It all ties together.
Let's start chronologically.
Ooh. Okay. Back in 1914. No.
What?
You start.
Well,
Oh.
if we start thinking about at your earliest
Are you talking about boobs?
point in life,
Breastfeeding?
breastfeeding.
Breastfeeding.
Breastfeeding's super important, but it's just the first point at which you are inoculated with
Mm-hmm.
mom's bacteria. Well, it's not the first point. Actually, a vaginal birth is the first point.
That's right.
They're now doing, interestingly, probably everybody knows this, but I'm going to say it anyway. So, large percentage of births are cesarean in this nation.
I know what you're going to say.
And so they have been thinking about how they can inoculate the baby with the vaginal bacteria, which is so important. And so they actually, some of the more progressive OBGYNs or midwives or whatever, they swab the mom's vagina and add that to the swab in the baby's mouth. And they actually then have the same bacteria that they would have had if they had been gone through the birth canal. And so that's really awesome. If you're going to have a cesarean, you might want to talk to your provider about doing that.
And then when your kid says, "Mom, I can't use your straw. Can you get another straw? Because I don't want your germs." You'd be like, "You are my vagina germs." Right?
Well, you might not have to say that. But anyway, so that's important. The very first inoculation is the birth.
vagina.
The birth.
Vagina.
Yes.
Say it.
Vagina. And,
She said vagina.
well, I'm familiar with these things. I'm a woman, right?
No. I've only seen pictures.
Second is, immediately after birth, they should put the baby with the mom, skin-to-skin contact. The mom's
Coated with bacteria.
coated with good bacteria, hopefully, except they make you take a shower with the anti-germ
Ew,
stuff
no.
before you. Yeah, no, we
What?
don't want to do that.
We'll do
But
that.
they do that. They ask you to do
Yeah,
that.
people are like wiping off their nipples and their areola to sanitize it before they put
No.
baby to breast. That's the whole thing. That baby's gonna eat dirt, like sterilizing all your people before they come in. That baby's gonna eat its feet. It's gonna eat rugs and dirt and shoes and rocks, and just let it inoculate.
So if the baby's not inoculated with good
Vagina, bacteria.
biome of the mom, be it skin or vaginal microbiome, what are they going to be inoculated with? Well, whatever germs are running around in the hospital, and that's not
That's
good.
a good point.
Yeah,
Hell yeah. I
and
like
we
that.
know that's not a good thing.
That's
So
quorum sensing. Right? They don't have the good stuff to take up the area, so then the other crap at the hospital overgrows and creates. We'll talk about all that.
So this is probably the root of dysbiosis.
Sherry, you're doing a great job. She didn't
Thank
say
you,
anything
Angela.
about Patrick doing a good job at all. Must have missed that comment somewhere. All right. So, what's funny is one of the first things I noticed in practice of doing this kind of stuff, right, is we'd have all these kids with IBS, but they have IBS in their 20s. Guess what they had in their teenage years? Allergies and asthma. And then guess what
Allergy-
happened when they were like
Well,
2?
as little children, they had allergies asthma too.
Yeah.
And then they outgrow it, and mom gives them milk because everybody's supposed to have milk, like my mother did. And even though I was allergic to milk, and you sometimes they develop a tolerance, or they develop other unrelated allergies, like, oh, I've got grass allergies, I've got cat allergies, I've got other kind of cat. But then when they get a little older, 20 to 29, that's when the gut stuff starts.
Yeah, so almost like immediately I noticed cesarean section, ear infections,
Yep.
antibiotics, allergies,
Yep.
and then IBS, and then Crohn's and ulcerative colitis. Like it was like I don't know, like the second time I kind of like went through that with a patient, I was like, well, that's weird because I just talked about that with a patient.
Yeah.
And then the next week and the next week and the next week, and you're just like, wait a second, I think I'm onto something.
So baby doesn't have the good germs, so then they start developing infections like ear infections, and especially if they're not nursing, because then their eustachian tube is not being, in the right position because of the tongue position, all that. There are people that can explain this a lot better than I do. But anyway, it's very important to breastfeed your babies. If I had known, I would have done it longer. One of mine was difficult. We won't say which one. And I didn't know any better. So I breastfed for 2 or 3 months, and I'm like, nothing's worth this. Well, I would now, knowing what I know now, I would continue. And the one that I breastfed less, is the one who got the ear infections and the thrush and the antibiotics and the tubes and everything. Yeah.
So
he lived.
Because there were issues with you nursing when you were a mom, is that why you became a nurse? So you can maintain nursing?
I don't think so. I don't think
that was clever shit right there. That's clever. Okay.
Okay, so germs. Germs are key. And so we start with breastfeeding, and that's important. And then what?
So if they don't, then you end up causing things, dysbiosis or SIBO. So tell us about that. You want to talk about that? You like talking about that?
Okay, but I want to go before that.
There is nothing before that.
There is before that. So if the child gets ear infections, even though it's been proven that most of the time they will get over them without antibiotics.
The Journal of Pediatrics said don't treat them.
Right. Journal of Pediatrics said do not treat them, but mom goes in and like, well, he's in pain. He's in pain. We know he's in pain. He's crying. I can't sleep. Give the kid some medicine. So even though most ear infections are actually viral,
boom,
they get antibiotics, but the parents say, but they get better. Well, yes, but they get better anyway.
They would have got better anyways, yeah.
So, but even if they do have a bacterial infection, they will get better without antibiotics. And there are things you can do also, which is we're not
going to talk about that?
Well, I don't.
We're not going to talk about it. You have to watch the next show where we're going to talk about it.
What we're going to talk about is the zillions of kids that get antibiotics, and it kills off primarily the good bacteria.
Whole species of bacteria.
Many species.
Right.
But you know what lives? It's the bad guys. And so a few live, and they're the strong ones that withstood the bacteria, the antibiotic. And so these really super bad, strong, tough guys are what repopulate the whole system.
Right. So you have 22 feet of small intestine, 6 feet of large bowel, but you have thousands. I mean, you have like probably 100 trillion. So you probably have like 50 trillion cells of good bacteria in there. But they use what's called quorum sensing. And I thought I was pretty smart telling Sherry about quorum sensing of bacteria. And then she goes, yeah, I already know, right? So the way that your bowel works is if you think about like, well, this is kind of all over. But you think about like you have all these different species of bacteria, and even yeast and other stuff, right? So they all live there in harmony, and they will sense how much room they have to grow. And so you don't have to know that. The body figures that out. So you will have the perfect balance of all these different bacteria that live in you, take care of you. And then you take say a broad spectrum antibiotic, and it'll kill off all the gram-positive and negative. So now we have these little villages that are the right amount, and we have all this then vacant housing. And so then this Clostridium difficile says, I'm going to take up this whole area now. And so it senses that it can keep growing out further. So its quorum sensing allows it to overgrow, and then it becomes Clostridium difficile, the bad version, which makes people die in the hospital.
Well, it's the same version. It's just like there's nobody controlling. There's no cops controlling.
Yeah.
The...
So it overproduces. It's kind of like Pat's really funny, but Pat with 3 martinis, no friends to keep him in check, Pat becomes the life of the party.
I'm the one that keeps you in check. Although, I don't know if I do a very good job. Well, but another thing...
and they're drug resistant.
They're drug resistant, and what feeds them? You know, you've heard the story about feed you have 2 dogs, the mean dog and the nice dog. Which one's going to get stronger? It's the one you feed the most. So we want to feed the good guys good things. But you know what the bad guys really like? They really like sugar.
Sugar.
And so if you are eating sugar and you're feeding yourself and your kids
sugar,
fruit juice or bread or grains, they all turn to sugar, and they ferment, and and so these are
So the average American eats 150 pounds of 150 pounds of added sugar to your diet, 50 different forms, and 65% of the antibiotics you take are overprescribed for viral infections. You kill off all the good, you overgrow even the good, which is called SIBO, small bowel bacterial overgrowth, and then you just feed it the hell out of sugar and things that become sugar very rapidly, and then you got yourself some gut problems. So those people should have horrible gas, horrible bloating, horrible inflammatory problems. It's going to make things like Clostridium difficile and some of those things, or H. pylori, when they overgrow or yeast overgrows, holy crap. You get lots of irritation. You're taking aspirin now because you're in pain all the time. It prevents it from clotting, and now all the inflammatory tissues leaking blood, and then now you're bleeding. You got tons of mucus. Your bowel hurts like hell. Every single meal's worse because you keep doing the same damn thing, and then you become an American.
And
what?
We have the gut-brain connection, and so you're likely the bad bacteria is making toxins which cross the blood-brain barrier.
That's right.
And you have depression and anxiety and foggy thinking.
You already feel worse because of this. But yeah, that messes with your brain.
And then you're depressed and hopeless, and you know your thoughts are not helpful.
Yep.
Yeah. So gut bacteria does that. Before.
Oh.
I don't know what that was. Someone made a comment here, Angela, I believe, that colostrum is very important in
immunosupport.
Immunosupport,
Yeah.
yes.
So what's colostrum?
That's the first liquid that comes to the baby from the mom before milk comes in.
Yeah.
And in
some
fact,
people do. What do you think of like colostrum from cows? Seems
you know,
sketchy.
one of my sons had chronic fatigue when he was a teen, and went to a alternative provider who prescribed colostrum, and it was extremely effective for him. We also, at the time, didn't know any better. We were doing raw milk, which also has some helpful things in it. It also, though, had the thing
it's just like
the thing I don't like about it, and why I don't encourage people to drink milk, is though because of the hormone situation, which we also had problems with.
And it's wholly allergenic.
It's very allergenic. But so you have to kind of weigh how allergenic you are to milk. I personally am so allergic to milk that I probably would not take colostrum, but depending, you know, it might be a thing for a short-term period. But for babies, natural colostrum from the mom is, of course, awesome and wonderful and perfect.
That's the perfect one.
Yeah. But beef, bovine colostrum, you'd have to go on a case-by-case basis with that.
So the gut bacteria part, like we cause that disruption.
We do.
And
mostly,
then we can work, we work with patients to get that normalized. But
did you know
what's that?
that changing your diet will totally change the ratio
I
of
was going to talk about that.
bacteria in as little as 2 weeks.
Is that right?
Yes.
You know, that's the same as the cow, you know, that makes that E. coli O157H7 that can kill.
Oh, that's right. It's 2 weeks also.
kill-
But you know why it's 2 weeks.
Yeah, I totally know, but let's tell them.
Oh, well, it's because, well, one reason
What?
is your gut cells turn over every 2 weeks.
Yeah, I knew that.
That it has an effect. It might not be the total thing, but apparently maybe bacterial cells, it takes that long to create new colonies.
So,
What are you looking at?
well, I'm trying to look this stuff for the last part, which is the food. Because every god dang patient that comes in, they've been to every specialist.
Every valued patient who comes in,
What's that mean? Oh, god dang patient?
we value our patients.
No, I know. But every patient that comes in
Yes,
went
they
to see all these specialists, and they all say the same damn thing, which is wrong. What do they say? They say
That food has nothing to do with it.
every damn time.
But,
But guess what it does? It's the food.
it's the
It
food.
is the food. And so even within this research from this meta-analysis, you know, it talks about, well, food can help, IgG can help.
It helps
but
11%. What did they do?
Holy crap.
They fed them.
Oh, yeah. This is the best thing.
Okay, it says it improve. Okay, if we change your diet, you will improve 11%. But what they changed their diet to was CAFO, red meat, and spelt bread.
Yeah. They
Yeah.
gave them inflammatory omega-6 meat and gluten.
Yes, yes. But they did say later in there that a semi-vegetarian diet was very helpful, and that's pretty much what we recommend is a semi-vegetarian diet, meaning lots and lots and lots and lots of vegetables and some fish. Fish was shown to be helpful.
Not fish sticks.
No, not fish sticks.
Yeah.
Good fish.
So it's a
fish.
no-brainer when it
Yeah.
comes to the food part because, but every single time they say it's not food, like all the eczema patients, all the Crohn's, ulcerative colitis, that's why we have such a freaking substantial
Well, you know why they say
rate.
that? It's because of this. It's
Yeah.
because they don't do the right studies.
Right.
When they do a study, they say, "Oh, we're going to do a study on to see if food affects your bowel disease," and then they feed them spelt bread and
It's
hamburger.
Got some problems. Yeah, that's crazy. It's absolutely insane. So when we talk about food and we talk about sustainable remission for a lifetime, it is a totally different thing than what they're doing in research. And so
Right. No one has done a research study, to our knowledge, on this.
We should publish our data.
We should.
Should. So
We might have to make more notes.
we talked about, so there's 3 parts that we're talking about with when it comes to Crohn's, ulcerative colitis, IBS, all those kind of gut stuff, right? Is we talked about the genetics part,
Right.
which is only the tiniest fraction of 1% of people that even have that, but if you still have that, you still should be able to get rid of that.
It's
right?
not the trigger.
So then we have the environmental stuff, which we went over tonight. And that really is all the stuff you can change. And sure, it all starts with a healthy baby born in a healthy way doing that. Now, there's all kinds of things. If you're a mom, you have enough guilt, don't worry about that.
No, don't worry
at
about that.
any
We all have
point,
guilt.
we always have the ability to normalize the gut, to normalize the diet,
2
to
weeks.
normalize the environment. Yeah.
Improvement is seen in 2 weeks. You might not be like totally better in 2 weeks, but
Yeah.
you can see improvement.
Yeah,
Enough
in
to
the
keep
first
going.
6 months,
Oh, I would say yes. Yeah.
if they do what they're supposed to, it's 99%.
Well, and it's not like it takes 6 months to get all better. It just, it depends on what's wrong with the person and how bad they are. But I would say it does not take 6 months typically.
So, and not 46% remission or reoccurrence rate, and not pooping in a bag, and not $25,000 to $50,000, and sustainability. So, those are all things we can control. That's all kind of what our lifestyle medicine protocol is all about. Anyways, next week what we're going to do is episode 166, and it's going to be on the third part, which is the reaction or immunomodulation of things like irritable bowel, Crohn's, ulcerative colitis. So that one will be really interesting, and that's where...
What does that mean, immunomodulation?
I have to look that up. So basically we have all these reactionary inflammatory responses, all these cytokines, interleukins, and those are typically where most docs focus. Now we're going to talk about all that, but the way that you fix that is the way that you fix everything else, right? So we look at the reactionary the reaction of environmental factors, but it's the environmental things that change it all. So as we wrap this up next week, we're going to talk in depth about the clinical part of the immune system, and then we'll kind of like wrap up with kind of sustainable changes, some simplicity, and talk about what we really do. But other than that, thank you guys for joining us, and we thank Sherry again for being here and lending us her expertise. And I thank you guys for joining us, and I really appreciate that you're a part of this. I love the feedback that you guys are giving, of course, and make sure that you guys ask your questions or make your comments, even for you guys that watch this off the air. And there's Sarah, finally. It's nice that you joined us today, Sarah. I hope we didn't, all right.
Sarah can watch later.
Thank you guys. I'll see you guys next week.
Okay. Bye.
Bye, y'all. Oh, and make sure to share this with anybody you know that has any kind of gut problems. So they need hope. They need to know there's answers. They need to know that they don't have to constantly be sick all the time. So, bye, guys.
Bye.
Oh, and the 20-something thousand they save, there is a tip feature in the payment. So if they want to tip that extra 20 grand, 25 grand, that'd be great. That'd be great. I'm just saying.